I'm Dr. Ben Behnam, board certified dermatologist. I specialize in stem cell hair restoration.
Hi, I'm Dr. Sean Behnam, and we work in the same practice, and I do all the hair transplant procedures and surgeries.
Welcome to another stem cell hair restoration video. This is actually a really cool one, so I'm very excited to talk about this one, Dr. Sean. So this was a female. She's a young female who came in and saw me on May of 2021, almost 2 years ago. She has diffuse, extensive hair loss. It's very diffuse and it's very extensive. She had already been on oral finasteride and oral spironolactone by another doctor, and nothing basically had really been helping. So we wanted to give a boost. So we decided to do the stem cell hair restoration for her. So now I'm going to show you a photo almost 2 years later, April 10th, 2023. So this is how she looked before, and with her we did something a little bit different that I usually don't do with stem cell. Usually when I do stem cell I usually try to focus it, but in her we really actually spread it all around for her. And this is her 2 years later.
2 years. So she lives out of state, so she can't come back for a 1 year follow-up, and at 1 year it was actually the thickest. But she came back for a second stem cell. That's when we took the second photo, and you could still see what a significant difference even at 2 years.
At 2 years, so you can see like a lot of hair really grew out all over, and she really boosted up like a lot of hair. I mean, she still needs a little more help in the center right there, but overall definitely a lot better. This is a very tough case. I mean, she's already been on a lot of different medications. Nothing has really been helping. So the stem cell really just boosted it. Obviously, it's not perfect, but she is, let me tell you, super happy.
It was a significant improvement, and for such a case, that's actually very important.
Yeah. And actually, it lasted more than we usually think the stem cell is going to last. And I think the reason is because she was placed on some oral medications that once the hair grew out, it just basically those medications maintained those hairs. Now the question is, why didn't the medications help her to begin with? No one really knows, but somehow the stem cell added some fire to it, and it really boosted to the next level.
Sometimes you need that boost from the stem cell, and these stem cells that we do are all also combined with PRP.
Yes.
And that stands for platelet-rich plasma, which is the growth factor that comes from your own blood, and we enrich the platelet level within the PRP between 1.1 and 1.5 million, which, you know, per cubic millimeter. That's actually very important.
Well, I hope you guys enjoyed the video, and I hope it was educational. Thank you so much. Have a nice day.